I am going to introduce about the low back pain. Most of cases that a patient come and then told me I went to a Western doctor already, and then doctor prescribed like anti-inflammation and also muscle relaxation and like pain relief, and then after that does not help. So I went back again. Then they said, okay, you have to take X-ray or MRI. So they have to take X-ray, MRI. Sometimes it's covered by insurance, but sometimes they don't have insurance. So taking X-ray, costing $300, and taking MRI, $1,000. So they have to pay for doctor's fee and the medicine. Then they already spent, $1,200, $1,300 already. But I still have a pain. That's the issue. So um, uh, when when they have muscle relaxation and the pain relief, things like that, sometimes they're helping, but most of cases does not help you much. On the top of that, if you go to let's say physical therapists, things like that, then or chiropractor, they know that how to find out which muscle causing that that problem. So they do all kind of checkup to find out which muscle has issue. However, when you go to a doctor, an insurance company does not cover those kind of checkup either, even though they know. However, insurance company does not pay for, so they do not do that examination either. That's the dilemma for a patient. So we got the news that some CEO got the killed because they don't pay. Not only not to pay the patient, they don't pay the doctor to acupuncturists either. So when patient comes in, I just observe and I know where to put the needle right away. The reason is most patient I personally treated low back pain. So I practice so many times. So low back pain is piece of cake to me. It's so easy to me. Why? Patient comes in, then while I'm examination and asking question and answer things like that, I ask the patient, okay, where the pain? Try the point, and then I have a pain in here. So sometimes pain on the right side, sometimes pain on the left. Very rarely, and sometimes they pain in the center too. So now. Many people believe that, okay, the X-ray shows or MRI shows the hernia disc is coming out this. That's not the issue, most of the cases, unfortunately. 50% of people, normal people taking MRI or in X-ray, hernia disc coming out already. But they do not have a pain in here. So the hernia disc came out. That's not the issue. So how do I do is I ask a question, where the pain? So what that means is What's the definition of pain? So in our language, qi and blood cannot circulate well. It's stagnated there. When you do not understand well about the qi and blood, I can explain you easy way. The blood contain oxygen and nutrition, and then because of due to the poor blood circulation, the oxygen and nutrition cannot be provided in the spot properly. That's why you have a pain. So what cause make a poor blood circulation into this area? Sometimes the issue coming from the from the neck. Sometimes from the head. Could be anywhere in the body. But when I look at all the textbook, it's about 10 different kinds of low back pain. But with my experience, most of cases is that coughing. That I have a pain. I could not. Sometimes I wanna pick up something from the floor, so I just then I have a pain. I think very rarely that I do husband and wife do something at the bed, then I have a pain since then. But most of cases that doing something, then I have a pain there. So while patient lying down on the table, then I ask, okay, try the point of wear. Then point of wear, then I just press, okay, lumbar 4 or lumbar 5, then I know where the pain exactly. That's why you don't need to take an X-ray or MRI. Just pressing this most better way than taking a picture and paying a lot of money. Don't be stupid. So because with that, then I put some needle in the back or in the leg, and then most of cases, I would say if the less than a week, most of the cases, then they just one time, that's it. But worst case, maybe maybe 2 or 3 times. When patient told me everything right, then my judgment will be right too. But they talking about all kind of different things. Sometimes make me confused. I believe, when patient come over and exactly write down everything and tell me, what happened exactly, then it is easy for me to make a right judgment too. But don't talk about it 20 years later, things happen. One time, this is worst case, I gave 8 times acupuncture treatment. But this is a special case. The patient got altogether in his life 5 times the surgery. So when I look at it, I saw the the skin, I got the surgery there, or in the center, on the side, on the left, I could. But the last one was done by laser. I could not find the hole either. But after this surgery, complaining same pain. So he went to the surgeon, then I still have pain. Then the surgeon told him, I have a similar case just like you. You got the surgery. Yeah, she still got the pain, and this patient went to this acupuncturist, and then he become fine. So why don't you go to this acupuncturist? So he took a picture smartphone. Then came to me. So after a session, he has not come back to me anymore. But once patient come, I give treatment. Sometimes I give exercise. You don't have to come back to me. You do this exercise 2 times in the morning and in the evening. Then you do this exercise. You don't have to come back. Then after treatment, they do this exercise. Most of cases, they don't show up again. So low back pain, remember, let me go to that guy. Thank you so much for your watching.